The muscles of inspiration are used to expand the lungs indirectly. These muscles are found largely in the thorax, and they're responsible for expanding the lungs in a couple of different ways. One is lowering, that's done by the diaphragm muscle to expand the lungs inferiorly, and the other is by raising the ribcage, which helps expand the lungs anteriorly and laterally. In addition, some of these muscles act as synergists to help stabilize the pectoral girdle in order to help with raising the rib cage. Inspiration in respiration is accomplished only by muscular contraction. As I mentioned, the diaphragm expands the lungs inferiorly. The rib cage gets expanded anteriorly and laterally by four muscles: the external intercostals, levator costarum, serratus posterior superior, and serratus anterior. We have stabilizers for the clavicle, the sternum, and the uppermost ribs that allow the other rib cage expanders to work. That include the sternocleidomastoid, the scalenes, the subclavius, and the pectoralis major and minor. And then we have muscles that stabilize the scapula, primarily to help the serratus anterior do its job, expanding the rib cage. That's the levator scapulae, the rhomboidus major and minor, and the trapezius. The diaphragm is shaped like an upside-down bowl with what would be the bottom of the bowl at the top. It's connected to the vertebral column, to the ribs in the lower part of the rib cage, including the costal cartilages and the xiphoid process. Bottom of the bowl shape is the central tendon. When the diaphragm contracts, that central tendon gets pulled downward by shortening of the diaphragm muscle in all directions as indicated on this figure. So the arrows here would be directions of shortening for the diaphragm, which has muscle fibers going from the central tendon to the attachment points for the diaphragm, radiating out in all directions. Normal respiration involves just the diaphragm. If we want to move more air, like if we're exercising heavily or during speech, then we need to use additional muscles. These muscles will be referred to as muscles of forced inspiration, and they will have the effect of expanding the rib cage. As I mentioned in the skeletal structures lecture, the ribs slope downward and forward where they attach from their attachment on the vertebrae to their costal attachments to the sternum in the front. When accessory muscles of inspiration contract, these force inspiration muscles raise and expand the ribs anteriorly, stretching out those cartilaginous connections to the sternum. The muscle that has the biggest effect on rib cage expansion are the external intercostal muscles. The external intercostal muscles run from the lower border of one rib vertically and slightly anteriorly to the upper border of the rib below. These muscles fill in the 11 spaces between the 12 ribs. They end short of the sternum where the costal cartilages are located, and they're called external intercostals because they run outside of another set of intercostal muscles called the internal intercostals. Putting the ribs and the external intercostals together, you can think of this as basically a big sheet of muscle that pulls on the lower ribs originating from the first rib. The levators costarum, brevis, and also longus, which are on the next slide, are muscles that are similar to the intercostals. They connect from the vertebrae of the spinal column to the rib just below that vertebrae, and that also pulls upward on the rib, given the joint between the rib and the vertebrae. It's a little bit like something rowing an oar on a boat, so pulling on that rib near the angle is going to help expand the rib cage. Levator's costarum longus are just like the brevis. However, there are only 8 of them instead of 1 for each rib. They come from the lower thoracic vertebrae and insert into ribs that are 2 ribs below. So they are slightly longer than the brevis, and they operate only on the lower ribs, which are the most mobile ribs that we have in the rib cage. The serratus posterior superior are a larger set of muscles that originate from spinous processes on the upper vertebrae, from the lowest cervical vertebrae through the first 3 thoracic vertebrae, and they insert in ribs 2 through 5, just laterally of the angle. It's the uppermost muscle on this image, and they have an action similar to the later levator costarum, where when they contract, they expand the rib cage, working across the joint between the head of the rib and the vertebrae. In addition to expanding the rib cage a little bit by contracting on the upper ribs, these muscles also work pretty well as stabilizers for these upper ribs to allow the lower rib cage to expand more. The sternocleidomastoid is a muscle in your neck. It comes from behind your ear in a location called the mastoid process on the skull that we'll talk about in a later unit. This muscle divides into 2 different pieces. It has 2 different heads that inserts into the sternum and also the clavicle. So the sternocleidomastoid name comes from the combination of the sternum, the clavicle, and the mastoid process. This is one of our stabilizing muscles for the upper thorax. So when this muscle is contracted, it helps hold the sternum and the clavicle in place for the action of other muscles. The scalenus muscles are a set of 3 muscles in your neck, referred to as anterior, medius, and posterior muscles. They connect from your cervical vertebrae, C2 through C7, to insert into your first and second ribs. The normal job for this muscle, and for the sternocleidomastoid as well, is involved in controlling the location of the head and head movement, but for respiratory purposes, these muscles also serve as anchors to the upper ribs, which hold them in place for rib cage expansion by the lower ribs, for example, using the external intercostals. The subclavius muscle is a small, tiny muscle running from underneath the clavicle down into the first rib. This muscle can assist in raising the upper chest primarily as a stabilizer, stabilizing the first rib relative to the clavicle being stabilized by other things, and then the first rib acting as an anchor for rib cage expansion for the other ribs. The pectoralis major is a chest muscle. It has 2 heads on the sternum and on the clavicle, and inserts into the upper arm. Primarily, this muscle is used for moving your arms around, but for respiratory purposes, it can serve as a stabilizer for the clavicle, which then connects to the first rib and the other ribs below for rib cage expansion. The pectoralis minor is a smaller set of muscles beneath the pectoralis major. They come from the 2nd through 5th ribs to insert into the scapula. So if the scapula is stabilized by other muscles, then these muscles can help raise the upper ribs or stabilize the upper ribs for raising of the lower ribs. The serratus anterior is a relatively large muscle that originates from the upper 9 ribs and fans down around the sides of the chest to insert into the scapula. When the scapula is anchored, the serratus anterior can be used to expand the rib cage, basically by pulling on the ribs just anterior to the angle, so pulling on the lateral parts of the ribs to directly laterally expand the rib cage in its middle area. The levator scapulae comes from the neck and the transverse processes of the cervical vertebrae 1 through 4 and inserts into the scapula, the upper edge of the scapula along its midline. So this helps stabilize the scapula relative to the vertebral column in the neck. So this would help anchor the scapula for the action of other muscles like the serratus anterior and the pectoralis minor. The rhomboidus major and minor muscles are similar to the levator scapulae. They come from cervical vertebrae 7 through the first 5 thoracic vertebrae and insert into the scapula, which is the shoulder blade, more medially. So rather than the upper part of the scapula, the medial part of the scapula. So again, this will help anchor the scapula for the action of other muscles pulling on the ribs. The trapezius muscle is a relatively superficial muscle that originates from the spinal processes of the vertebrae throughout the back, from the cervical vertebrae all the way down through all the thoracic vertebrae. It inserts into the upper surface of the clavicle and the scapula. In basic anatomy, the function of the trapezius would be more for moving the neck or for stabilizing the arm, but in the case of respiration, it helps support the clavicle and the scapula. So again, it's a synergist for other muscles that anchor to the clavicle and the scapula to be able to be used for respiration.